Okay, I'm starting this video only to do my hand hygiene in the bathroom first so I could go to the other room because of the sink. So you're going to turn on your water with warm water and get your soap. Scrub for 20 seconds. And you want to get underneath the fingernails and in between the fingers like this. Do that for 20 seconds. And then you can either leave the water running, get a paper towel to shut it off, but I'm just going to shut it off because it's my house and I don't want to leave it running. And then for the drying, you take individual paper towels. I still have it in here. And you're going to dry away from the hands like this. And if you had a paper towel, you'd use it to shut the water off. Away from the hands. Good. So I'm going to go into my patient's room. Hello.
Hi.
Hi there. I'm Chloe. I'm going to be your nurse today.
Nice to meet you.
So I'm going to just provide you with some privacy here. And could you just go ahead and tell me your name and date of birth, please?
Sally May, June 9th, 2006.
All right. And do you know your height and weight by any chance?
5'2", 120 pounds.
All right. So can you just tell me the time of year, the season, and any holidays coming up?
It is fall. It's November. Today's Wednesday, and tomorrow's Thanksgiving.
Excellent. So I'm going to give you 3 words, and at the end of the assessment, I just want you to try and remember them and repeat them back to me, okay? So we're going to do coffee, dog, wallet.
Okay.
Coffee, dog, wallet. All right. So I'm going to just start off with your head, palpate for any bumps or lesions, anything like that. Look at the scalp. Everything looks fine. Next, we're going to move on to your ears. So I'm just going to make sure that your ears are symmetrical. And do you wear hearing aids?
No.
Okay. I'm going to whisper. Can I have you say that for me? I'm going to be testing cranial nerve number 8, which is your vestibulocochlear. So I'm going to whisper 3 words for each section of your head, and you tell me, just repeat them for me. Chip, chip, window, bed. All right, and then also while you're standing, I'm going to have you stand with your feet together, eyes closed, and I'm going to assess you for any swaying or balance issues. Looks good. So that was, again, cranial nerve number 8. You can take a seat. So within the ears, I'm going to make sure that you have no drainage on the inner and on the outer. And then I would pull the pinna up and back to look for that clearish, gray, pinky membrane. Awesome. Okay. Next, we're going to go with your eyes. So do you wear glasses?
No.
Okay. So we're going to start with this far distance Stalin chart from here. Just read these letters on the page.
A, B, C.
Okay, and then the Rosenbaum test. You just, for up close.
A, B, C.
Okay, and that assesses cranial nerve number 2, the optic nerve. And then I'm going to have you look up. Okay, and I just look for this upper eye movement is cranial nerve 3, oculomotor. And I'm just going to take a look at your pink, at the mucus, at the lower eyelid for pink and moist mucous membranes. And I'm also going to look for ptosis, which is drooping at the eyelids at all. I note that the sclera is white and the iris is a bluish gray color. Next, I'm going to be looking at her pupils and do the Perlo test or Perlo exam. So in normal light, I note that her pupils are about a 3 to a 4, and then I'm going to test for constriction and dilation when I bring the light over. So in the light, they get smaller, and then when it gets semi-darker, they get a little bit bigger. So constriction and dilation. I note that the pupils are equal, round, reactive to light, and then if you follow this pin inwards, this is accommodation, testing cranial nerve number 3. Next, we're going to be doing the cranial nerves 4 and 6, the trochlear and abducens, and this is when I test the 6 cardinal fields of grace. So just follow this up to the middle, down, side to side, and then diagonal again. Excellent. Correction, I have to make sure to palpate the ears before I'm done with the ear exam. And then continuing on the eyes, I'm going to palpate the eyes for any bumps or masses. And I again noted there was no drainage coming from the eyes at all. Next, we're going to move on to the nose. So I'm just going to take a quick look at your nose, make sure that there's no bumps or anything, or note if there are any bumps. I'm going to have you close one nostril, breathe in and out. And again, same thing on the other side. Okay, and I just want to palpate the sinuses. I also want to note for pink and moist mucous membranes within the nose and note if there's any type of deviated septum. I would also have you smell something to assess the olfactory nerve, cranial nerve number 1. What do you smell?
Apple.
Perfect. Now we're going to move on to the mouth and facial nerves. So I'm going to assess the mouth that there's no drooping or drainage of any sort coming from the mouth. I do notice that there is no dry skin, no discoloration. And do me a favor, can you puff out your cheeks? Okay, smile. This is cranial nerve number 7, the facial nerve. And then raise your eyebrows. And also, this is testing cranial nerve number 5, the trigeminal. So I'm going to take a look inside your mouth and assess the buccal and oral mucosa of the cheek and the gums. No teeth, no dentures, right? Okay. And then why don't you stick your tongue out for me? I don't see any color coating on the tongue. And lift up. Lift your tongue up. And then side to side. And that test cranial nerve number 12, the hypoglossal. Stick your tongue out for me, please. And I would test the gag reflex with cranial nerve number 9, but I won't actually do that. And then if you say, ah, I just test for movement of the uvula, which would be cranial nerve number 10, the vagus nerve. So again, to finish out the mouth assessment, I'm going to palpate around the mouth and lips for any bumps I feel. And I would have you, here, go ahead and try this chip for me. Tell me what the flavor is. Tell me what flavor you know with that.
Salt and vinegar.
Perfect. And that would again go with olfactory, the smell and taste. Alrighty. Now we're going to move on to the neck. Let me see what time I'm at. 8 minutes. Okay. We're going to move on to the neck. So I would first take a look at her neck and note for any jugular vein distension. The trachea is nice and aligned. I can feel for that. I would assess for the presence of lymph nodes, which I should not technically feel if the patient is healthy, as well as palpate the thyroids. I'm thinking about it. So I'm going to have you swallow for me. I should have done that first, but I forgot. So that would be cranial nerves 9 and 10, the glossopharyngeal and vagus nerve for swallowing. And then I'm gonna check the skin turgor. That's something I keep forgetting to do. Skin turgor, non-tending, which is good, means you're hydrated. Then, yeah, I did that. I'm gonna have, that's next. I'm gonna have you, can you extend your head backwards, forwards, side to side, kind of, and then push your hand against my head. Good, and as well as on this side. Great. So that is assessing cranial nerve number 11, spinal accessory nerve. Excellent. Hopefully I'm not missing anything. Yeah, we did that. Next, we're gonna move on to upper extremities, right? Okay. So I'm just gonna take a look. You may not have to do that. That's okay. I don't know. I would just take a look at her skin for any.
Just it.
Okay. Don't lift up your shirt. There we go. For any bruising along the arms, I would also look for hair distribution. Speaking of hair, my hair looks silly. And yeah, bumps, bruises, any like wounds or anything like that on her skin. This is a lot, so let me think about it. I would. Oh, are you having any numbness or tingling in your arms at all? Good. Okay, so I am, at some point within this, going to assess for, the brachial pulses of, the inner arms. Both of them, and note if they're bounding, diminished, anything like that. 2 is normal, so I would say they're 2+ for this, as well as the radial, and I would note a 2+ for that as well. Correction, on the neck, I need to assess the carotid one at a time. Continuing back to the upper extremities. Okay, so I did your pulses. Can you lift your arms up? Push, 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 and push down against me. Great. And can you demonstrate your movement capabilities in your arms, shoulders, elbows, wrists, and fingers? Good. Why don't you go ahead, squeeze my hands. So I'm testing for grip strength. So the stronger it is, the higher the number. I will give you 5 for all of these. I lost my train of thought. Okay, you pushed up against me, everything. What is it called? Capillary refill. I'm going to check your capillary refill to be less than 3 seconds for each finger. I would do all those. And then I would also check for clubbing of the fingernails as well. We're going to move on to the chest, right? Let me get back in the chest. Okay. Sorry. Oh my god. Okay, let me get my stethoscope. Okay, so we're just going to take a listen to your chest here. So I'm going to assess for, I'm going to take a look for any lumps on the chest at all. And I would listen first, really. I would listen to the lobes of the lungs, back and forth. Also, you would do this under the shirt. I won't do that for educational purposes. Okay, so I do all lobes of the lungs. I note clear lung sounds, which is great. And then I palpate. Then I go to the posterior side of the body. Again, inspecting for anything abnormal on the skin. Take a listen. Auscultate all lobes of the lungs. All the way in kind of like this pattern, like that. All the way down. And I would note clear lung sounds for that as well. And then again, palpating, just to double check. Questions. Are you Do you have any type of cough at all? Any shortness of breath? Dizziness? Like any difficulty breathing? Anything like that?
No.
Okay, good. Yeah, dyspnea would be one of the words for that. Good, so no issues breathing. Now I'm just going to take a listen to your heart. So I'm going to start with the aortic part of the heart right here. And while doing so, I'm going to listen for S1 and S2. So aortic is here. Mitral, aortic, pulmonary, Erb's point, thoracic, a little bit lower, and I actually do hear all these. And then mitral would be kind of diagonal. I really do hear all that. So I would know the rhythm of the heart, I would say sinus rhythm, and the rate would be 1 minute of listening to them. I don't have time for that. Excellent. Okay, we did the chest. We did all that. I palpated you. I listened to your heart. Now we move on to the gastrointestinal. So I'm just going to ask you a few questions about you. So, do you have any issues going to the bathroom? When was your last bowel movement?
Today.
What about urine?
An hour ago.
Okay, and do you know the color of your urine at all?
Like light yellow.
Okay, and any issues with that? You said no. Okay, good. So you're not incontinent, I take it. Any constipation, diarrhea, nausea, vomiting, anything like that. Okay, good. So I'm just gonna have you take a lay back, and I'm gonna take a listen to, what am I at, 17 minutes? Okay, to your bowel sounds. So when listening to someone's bowel sounds, you want to listen before you inspect, take a look at the abdomen to note any distension or anything like that from what you can visually see. So you start in the right lower, it's called right lower, and you listen. You listen for a minute in each quadrant to make sure you hear 5 to 30 within each minute. If you hear less, you listen for a full 5 minutes in that quadrant, and as well as if you hear more. So you just go 1 minute for all quadrants, right lower, right upper. I'm gonna actually take a listen. Left upper. There's one. And then you're gonna go left lower. So you should hear a little bit of gurgling in there. Okay, and then after you listen, you want to palpate because you do not want to mess and push on any of the things and mess up the natural rhythm of it all. So go ahead and sit up. Let me think. Now we're going to move on to your, right at the end, the lower extremities. A little bit to do here. So are you having any numbness or tingling in your legs at all? All right, good. I'm going to assess your pulses. So I would check the femoral pulses, and again, note if they're thready, bounding, normal, or diminished. So like this, I do femoral, popliteal under the knee, posterior tibialis right around here, dorsalis pedis right above on the front of the foot. And I would do those at the same time. Again, I would give these all 2 for normal pulses. I would assess the legs for any, sorry to tickle. I would assess the legs for any edema, and I would note pitting edema. I would note 0 if that's possible. If it only goes up to 1, I would note 1+, meaning it bounces right back. There's no edema there. So I'm going to have you push up against my legs, my hands, and then down. Again, with your feet, push up against my hands and against my hands again. And let's see. Again, with the toes, just like the fingers, I'm going to, I would take your socks off. And I would have gloves on if this was a real patient, just to be safe, and assess clubbing of every single little toe. Just kidding. I will have you stand up for me. Thank you. And I'm just going to have you walk over here. Come back. So I'm just assessing her gait and mobility here. Then I believe we're at the end of our assessment. So I'm going to ask you, what were the 3 words I gave you? If you remember them, if I remember them.
It was coffee and wallet and
Another one.
dog or shoe.
Yeah.
I
Depending.
think.
We've done this so many times. Yeah, close enough. Okay, thank you for being my patient. Everything looks wonderful. Awesome.